I didn't know what I wanted to do. I knew I wanted to do something in healthcare. My father, being the immigrant father that he was very practical and said, "You're interested in healthcare, go and apply at all of the hospitals locally." 3 weeks later, I got a job in the pathology department. And there I began to learn about the role of pathology in healthcare. It's foundational to healthcare. Cytotechnologists are pathologist assistants that help primarily identify precancerous and cancerous changes with the overall goal of getting treatment before the disease spreads. This program is as old as the School of Health Professions. We've been around since 1976. We have a reputation of training empathetic but very skilled practitioners that are integral members of the patient care team. We have clinical partners from Connecticut all the way down to Delaware and opportunities across the country as well. The vast majority of our education is actually hands-on. All of our students in the program, they get their own microscope. We have thousands upon thousands of cases in our teaching set. We also have a wet lab that they're going to be learning how to hands-on prepare samples taken by clinicians from head to toe. We are really cell detectives. The molecular diagnostics piece has been opening a different avenue for practitioners. AI has really opened up the door in cytology across pathology. And so we're seeing the development of platforms such as digital pathology and telepathology that is really revolutionizing practice. The clinical rotations, they comprise the bulk of the last 2 semesters of the 4 semesters. We aim to rotate our students through at least 4, and they're going to be sitting and working alongside practitioners. Those clinical site supervisors, they mentor our students, and then they become their supervisors or managers. 100% of graduates are employed even before they finish the program. Our students leave here with 5 certificates that the employers love to see. We are always happy for folks to come to campus to talk with the faculty, but also talk with the students that are being trained. And I'm also always happy to connect them with alumni so that you can get the perspective of someone who's gone through the program and now in practice.